Welcome back to the CivDiv. Today we're talking about feet and the conditions vets are able to claim. If you enjoy the information we put out, like and subscribe so that we can grow the channel even bigger and provide more information to you for free. Without further ado, let's get into it.
Whiskey 9 Yankee 7 November Golf, over.
We know that as vets, we punish our feet from the start of our careers all the way until we are about to get out. You go home, you take off your boots, and you can barely recognize your feet because they're all jacked up. Well, they're jacked up because there are a few different conditions that we develop due to our boots, due to the rigors of military operations and lifestyle that we can claim under the VA. So let's go ahead and talk about them. So just a disclaimer up front, there are a lot of foot conditions that we can claim, but we're going to talk about the 9 most common. There are, like I said, there are more, but these are the ones that we see most ubiquitously among the vets and the claims that they put in. So the first one that we're going to talk about is flat feet. Flat feet, the arches on the inside of the feet flatten when pressure is put on them. So this condition has a rating of 0, 10, 20, 30, and 50, and it has considerations for both unilateral and bilateral symptoms for the overall rating. And it talks about the severity of each of the flat feet effects, leading to instability, leading to actual deformities, and so on and so forth. Next, we have plantar fasciitis, which is the inflammation of the plantar fascia, the tissue in the foot used during walking and foot movement, that has a rating of 10, 20, 30, and just like flat feet, it has a rating for unilateral and bilateral. The third condition on the docket is metatarsalgia anterior, aka Morton's disease, a feeling as if you're standing on pebbles, so you have that kind of phantom pain in your shoe, a burning pain in the balls of your feet that may radiate into the toes. And this carries just a basic rating of 10%. Okay, so before we move on, there is something important to note. The VA will only rate you on one of these conditions because the symptoms are too alike. According to the M21, the evaluation criteria for flat feet and plantars are similar enough that providing separate evaluations will compensate the same facet of disability for foot pain. And it violates the prohibition of pyramiding. And the same thing goes for metatarsalgia. The evaluation criteria are similar enough that providing separate evaluations will be akin to pyramiding. So essentially, if you have both of these conditions or symptoms of both, they'll either do a combination of the two, kind of giving you an average, or they'll take the higher of whichever one is presenting the most symptoms. That's basically how they're going to do it. Okay, so the fourth condition is clawfoot, a foot deformity. The joint of the toe closest to the ankle is bent upward and the other joints are bent downwards. The rating is 10, 20, 30, and 50, accounting for both lateral and bilateral, or unilateral and bilateral symptoms as well. The fifth condition is hammer toe, a deformity of the second, third, or fourth toes. In this condition, the toe is bent at the middle joint so that it resembles a hammer and must not have foot claw. You can't have foot claw in that toe as well. And it is based on a 10% rating. Number 6, I combined 2 different conditions affecting the big toe, hallux valgus and rigidus. So it's a resection of the big toe and the stiffness in the big toe joint. Both conditions entered at 10% ratings. Number 7 is weak foot. So it's a symptomatic condition secondary to many constitutional conditions characterized by musculature atrophy, disturbed circulation, and weakness. This condition has a 10% rating, but depending on the cause, Most of the time it's going to be a secondary, so it's just going to be an addition to, so definitely worth pursuing. Number 8 on the docket is degenerative arthritis. Comes in with a 10% or 20% rating, depending on the number of joints affected in the foot. Last but not least, we have general foot injuries. This is anything that does not fall under the other conditions that we talked about, and it refers to partial or total loss of use of the foot. And it comes in at a 10, a 20, and a 30% rating for that general foot injury rate. So you know I can't make it through a video without mentioning it. Okay, as always, when considering filing for a claim, it's not enough just to have foot pain. You have to have the big 3, right? In-service evidence, illness, injury, a current diagnosis, and a nexus connecting the injury to your service. If you have those things, listen, if you have those things, service connection will be there. If you don't, and you put in the claim, you are, I can't even give you a percentage. Some would say 50-50. It's probably less than that of a chance of getting service connection, because you're banking on the CMP examiner to giving you that nexus and the current diagnosis. But if you have a shoddy CMP examiner, that the chances are pretty low. So make sure you have your evidence, develop the claim as much as you can before submitting, and then bring that evidence with you within that submission. That's the best way to ensure that you're getting the service connection that you want. All right, guys, that's all I have for feet. So we went over majority of the foot conditions that we see from a lot of the viewers, a lot of the people that reach out to us. There are a few out there that are a little bit more niche, but we wanted to get the ones that majority of the people actually put in claims for. But as always, this is Jay with TheCivDiv. Stay informed, stay resilient, and I will see you next time.